This is the One Thing Podcast, and I'm your host, Dr. Adam Rindy. The One Thing Podcast brings together leaders in functional and naturopathic medicine to discuss actionable information that may unlock puzzles in the areas of gut health, brain health, metabolism, and longevity. Please note, these episodes do not replace the opinion of your doctor. They are not intended to diagnose or treat any condition. Please discuss this information with your provider and discuss your own unique personal health history before adapting this information. Please subscribe to our episodes so that you can stay on top of the most current information in these areas of medicine. How's it going, family? Welcome to the next episode. In this episode, I'm excited to welcome on Dr. Deanna Berman. We're going to speak about biofilm. This is a very important topic in chronic illness, and it's often overlooked when people are addressing conditions such as autoimmune disease, inflammatory bowel disease, IBS, sinus problems, urinary tract infections. The list goes on. Biofilms are pretty much hanging around in chronic conditions that involve hollow spaces of the body. So we get to speak with an expert today in the clinical treatment of biofilms. There's a lot of researchers out there looking at this topic, but it's always great to welcome on a clinician who's actually out there dealing with conditions related to biofilm. In just a moment, I will introduce our guest, but I just want to thank you so much for joining us once again on the One Thing Podcast. I hope you enjoy this episode. Dr. Berman is someone who was on a previous episode with the One Thing Podcast. She practices in Vermont, and she's a naturopathic physician and also a licensed midwife. She has some very interesting expertise. She has a expertise in interstitial cystitis and other women's pelvic health disorders, such as chronic UTIs. And she also knows quite a bit about our topic today, which is biofilms. She has a background in working with lots of infectious diseases and really has a great handle on chronic disease and chronic infection. So I welcome you. Her website, we'll refer to that at the end of the episode or right now if you want, but there's Dr. Berman is very active on social media, on Instagram and Facebook, and I'm sure you're going to enjoy speaking with her or listening to her today like I will. So Dr. Berman, welcome, and thank you for being here today.
Thank you so much for having me. I am very grateful to be here and to share what I know and help lots of people through this. And I am also practicing in New York, but I'm doing mostly telemedicine at this point because, I started working with many women around the country and then around the world internationally who have chronic recurrent UTIs and have been diagnosed with interstitial cystitis and chronic bacterial vaginosis and other pelvic issues. So now, I've kind of become a specialist in those issues, but so grateful because it's so needed. We need doctors who understand these issues.
Yeah, and you've been doing this for quite some time, and that's why I really enjoy speaking with you, because you've been through sort of several different journeys in your own profession, and you've seen a lot of patients, and from that experience you bring a wealth of information. So thank you for being here with us today. How did you start thinking about biofilm in general? Like what led you to the kind of topic of today?
So I started learning more about biofilms because I was working with I'm a Lyme literate doctor as well. And I had worked with many people with chronic Lyme disease and other chronic infections, and they weren't getting better until I learned about biofilms. And biofilms, starting to break up the biofilms was a game changer in helping them get well. In the world of interstitial cystitis, basically my opinion and the opinion of many other doctors is that if you have bladder symptoms, you have a chronic infection. And if you have a chronic recurrent infection, whether it's otitis media or a sinusitis or SIBO or H. pylori or various other chronic infections, there's bound to be biofilms. So I started researching biofilms and how do I help people break up these biofilms so they can get better?
Okay, yeah. And so when I first started hearing about biofilm in human health, my experience with it was just as something that forms on plastics or maybe on the pond of a lake. To think about it being in other regions of the body was something completely new to me. Can you just explain just some basics, like what is a biofilm in the context of what we're talking about today?
Yes. So the basics of a biofilm is it's a group of bacteria. So there's bacterial biofilms, and then there's actually viral biofilms that are called viromes. And there's fungi. And when I actually first learned about biofilms, I thought they were all together. And I think some places they are all together, but they will form anywhere that there is liquid, basically in the body, like in the urinary tract, in the circulatory system, in the sinuses, in the lungs, anywhere there's fluid, and in the water as well. So what they're finding is what's very interesting in certain areas where they dump a lot of antibiotics into the water. There's a high production of antibiotics, like in India. They actually have very strong biofilms. The antibacterials are not penetrating those bacteria, and it can actually create stronger biofilms. So these biofilms are kind of colonies of mostly bacteria and viruses and yeast, and they share genetic information. So what happens with the biofilm is as it's around longer, it gets stronger and harder to penetrate. And also the bacteria will multiply inside those biofilms, and they'll share the genetic material. Like if there's an antibiotic resistant infection inside the biofilm, that bacteria can share the antibiotic resistance genes with another bacteria in there.
So even like backing up further, is it just kind of like a blob of mucus that's filling up space in different orifices and
yeah, so it's actually, yes, it's like a blob, and initially the initial phase of the biofilm was just kind of the bacteria, and then it builds this matrix of like DNA and proteins and carbohydrates, and that matrix and then it will adhere with like fibrin to the, it can adhere to a catheter, it can adhere in the ear, in the, there's biofilms in the ears, it can adhere to anything pretty much. So then it adheres, and the longer it's there, it builds up that exterior matrix stronger. It was interesting. I was looking at this video where they actually could see the bacteria and the matrix pulling out from the biofilm. Wow. And so the bacteria will come out of the biofilm and kind of be released. And someone said it was like a metastasis. So they're theorizing that the biofilms, these really strong biofilms, are forming in the GI tract, which makes a lot of sense to me, because we're getting a lot of like antibiotic resistant infections, especially E. coli, from our food and our water. And then these stronger infections, if they actually do form in the digestive tract, and then they can kind of break off or metastasize and form in other places in the body.
Yeah, and it's really interesting that if from a 20,000 foot view, you could just think that this is just sort of this inert material, and there's this whole world going on, like you're alluding to here, of signaling and basically these bacterial colonies or viral colonies. They've created a form of protection for their survival, right, with these biofilms.
Absolutely. That's what they're doing. And more bacteria live in biofilms than in the free-form state or planktonic state. Most bacteria, it's natural for bacteria to form biofilms.
Okay.
And the real issue at this point is that the bacteria, because theorized that it's from the chemicals and the antibiotics, that they're stronger. The bacteria are stronger, more virulent. I mean, there's so much research being done on certain bacteria, like, for educational experiences or trying to make more antibiotics, but these bacteria become stronger and more resistant to whatever we throw at them.
Yeah, excuse me. I've been hanging out with my 4-year-old a lot lately, and I'm just thinking of like some of the games that he plays with me, and like having like a shield and anything that is coming to stop him. If he has a shield, he's good to go. So I can think of the bacteria being exposed to penicillin or amoxicillin and various other agents that are reportedly designed to get rid of them. And if they have their shield up, then it's a form of protection.
Absolutely, and it's causing an epidemic of chronic illness.
Yeah.
And unfortunately, what I believe, like Crohn's and colitis, is the same thing as interstitial cystitis, and even allergies. When people have chronic allergies that they develop later in life, I believe it's often biofilms in the sinus passages or in the gut or in the bladder. And basically the doctors don't find them because they're living in these biofilms. They're not free floating. So
yeah, that's
won't
a
be
really
detected.
that seems to be like a diagnostic challenge, and if someone's being assessed for an infection and the bacteria is not showing up in the sample.
Yeah, I mean, I'll just speak a minute about the UTI world. In the UTI world, 40 to 60% of infections are missed on a standard culture. And one of the reasons is that the bacterial load is too low to be detected by the standard of detection. Another reason is that when you have a biofilm with multiple bacteria and they release multiple bacteria into the environment, then you have more than one bacteria, and there's competition between bacteria.
Okay.
In the free floating form. So you won't detect what, and actually most cultures, they test for one bacteria at a time. But I do some advanced DNA testing with a lab called Microgen DX. And that lab helps me, when you read it properly, it tells you, okay, there's a small percentage, it's a 2-part test, and it will tell me, okay, it looks like there's biofilms, we can't guarantee it, but pretty much if there's a chronic infection, there's biofilms. And also it gives me generally multiple bacteria, I've seen up to 15 different bacteria on one test.
Wow.
Yeah.
Okay. So before we leave this description here, I just want to make sure I understand one core concept. So even in a biofilm presence, the non-free-formed bacteria or virus can cause symptoms that are sort of classic infectious symptoms, like whether it's diarrhea or fever or achiness or bloating. Can they cause it in the biofilm, or do they have to get out of the biofilm to cause those symptoms?
I would say that would be hard to say. All I can answer, because one, you would have to have a method to absolutely detect whether there's free floating bacteria or not. Because if there's only a biofilm and no free floating bacteria, that would be different. But I can't say. I would imagine most patients who have a chronic illness, there's both free floating bacteria and a biofilm. And
Okay.
Biofilms do release cytokines, and they're different inflammatory cells, and they're different than the cytokines released from one bacteria. So it's sort of like when we look at polypharmacy, or using multiple medications all at once, right? We don't know how those work together. It's the same thing. We don't know how this combination of bacteria works together.
Yeah.
And what kind of release, what kind of inflammatory response it causes in the body.
Mm-hmm. Yeah. Okay. Well, that makes sense to me, that there's sort of those bacteria that are out of the community could also be causing symptoms. So, well, you've already said this, but I'd like to just kind of hear, like, how does someone know that they may have a biofilm issue? Like, what would be like a clue, just from a symptom or standpoint, or a sign or a lab test?
So, well, pretty much we all have biofilms. It just depends on the phase of the biofilm. And I want to talk a little bit more, remind me to speak more about the phases of biofilms. But basically, if you have been treated with antibiotics and you get better and then you get worse, or you've been treated with antibiotics and that you don't get better, or you've had an illness for more than 6 months, you probably have stronger biofilms. Now, everyone has biofilms, and it's just a matter of, are we breaking them up? There are things that our body does to break up biofilms naturally, but there are things that put us at higher risk for developing stronger biofilms as well.
Okay. And can you comment on those?
Yes. Okay. So basically, we have to look at this as a continuum. So we are exposed to bacteria all the time. We have bacteria we have bacteria in our body. What I like to talk about is, like, okay, the gut. Let's take a really healthy person that lives in the blue zones and has had an immaculate diet, not exposed to chemicals, not exposed to glyphosate, and they're very healthy. They have a microbiome in the gut that is between 700 and 1200 different bacteria. Okay. Now those bacteria will continue to make biofilms, and then they'll break up the biofilms because this person's really healthy and they have good hydrochloric acid and good digestive enzymes that help break up those biofilms. Plus, they're eating foods with really great herbs and spices and variety, and that's going to help their body break up those biofilms. Okay. Then, you can go to someone in the US who eats gluten and is exposed to glyphosate, which is a broad spectrum antibacterial, and who's been in the hospital because they had an infection, and they may have been exposed to, some kind of E. coli infection. And so in the gut, we're just taking the gut. So those people, they've had some illnesses, they've taken some antibiotics for different things, even short courses. And what grows back is not the same healthy microbiome. Plus, the microbial diversity, the diversity of that gut microbiome is going to be different. And so they probably have between 500 and 700 different microbes in their gut. Okay. So these will also break up biofilms. But let's say they're taking a proton pump inhibitor and they're not producing good enzymes because they're stressed and their digestion's not working optimally. So they don't have those natural enzymes and hydrochloric acid to break up those biofilms. So they start forming a stronger biofilm. And then they're exposed to some, Klebsiella strain in the hospital that is more virulent. It's stronger. It's more resistant to antibiotics. And that bacteria gets into that biofilm. And now they've got this really strong biofilm. So now we have to start breaking up those biofilms. And that's just really the gut. So then we can look at, the microbiome projects where they looked at the different microbiomes in parts of the body, but some even speculate, if you're looking at people in the US, we live in a post-industrial microbiome that we're exposed to so many things that have antimicrobial effects that, it's not the same microbiome that we would have had 150 years ago, or that person who lives in the blue zones.
Yeah. So in a sense, like, we've had to become tougher to survive in this world, with all the different, from a standpoint of humans, we've had to become tougher to survive with chemical exposures and the changes in our food supply. The microbiome that's living within us is also going through the same thing, and so the microbiome is going through adaptive strategies as well. So what I'm hearing you say, which is really interesting, is that it's things that kind of are like chronic antibiotic exposures, in the food supply that could generate biofilm. And then it's also just having a chronic infection that could generate biofilm. And so and then things that lower the defense against infections, like low stomach acid, can generate this environment where you have biofilm?
Well, naturally, the hydrochloric acid and enzymes and aromatic herbs and spices will naturally break up early phase biofilms. That's a natural process. So why I say that is that one of, what if we just take one factor, the fact that most of us are stressed and don't produce as, enough enzymes and hydrochloric acid, or we're taking medications to suppress our hydrochloric acid, that affects our ability to break up the biofilms. Plus, we've changed our diet. On my website, I have a little ebook I created, which is geared towards UTIs, but I do speak in there about foods that help us break up biofilms and, things that we naturally can do. And then we used to eat like most cultures have some form of fermented foods or chutneys or things that help our bodies to break up biofilms and replenish our good microbiome naturally. But we don't eat that way anymore. So we eat less spices, and a lot of people with chronic infections, what I hear all the time, oh, I can't eat spicy foods, and especially if they have epigastric issues, if they have GERD or they have, I'm seeing an epidemic of gastritis now in young people. So then they cut out all the spices and they cut up all the herbs. Film problems worse.
Mm-hmm. Yeah, that makes a lot of sense. And so there's just sort of this environment now where, where infections have the ability to hang around longer. And, I think most people who are addressing like an infection, like say H. pylori or C. diff or, chronic C. diff, these kind of chronic infections, don't even think about this level of treatment. And no wonder, we're getting so much reoccurrence.
Yeah, we need to start. There's a lot of research on biofilms. It's been going on a long time, but still in the UTI world, at least, doctors don't even address it at all and will say to their patients, oh, biofilms don't exist. Mm-hmm. And that's not true because there's plenty of research. I was just reading a paper that talked about E. coli strains. And we have an epidemic of we're seeing more resistant infections across the board, and so what they're doing, they've been tracking this antibiotic resistant infection situation for a long time. And a lot of ESBL E. coli, which is a very resistant E. coli, it's resistant to multiple antibiotics, but also the strength of the biofilms. So the ESBL E. coli versus standard E. coli, the strength of the biofilms is very stronger. Now, what they'd have to do is look at H. pylori and strep. The ones that I see are the worst are the strep, H. pylori, but even C. diff is hanging around. I do a GI map and I see more C. diff, Clostridia, than I used to see. And definitely more H. pylori and strep, Klebsiella. And these aren't only urinary tract infections. These are things that I'm seeing in the digestive tract as well. Yeah. So we all need to start, considering, even if we're not dealing with a chronic illness, how to prevent a chronic illness, how to eat to break up biofilms, how to keep our digestive tract healthy so that these stronger, more virulent biofilms don't form.
Yeah. Well, I want to circle back just a little bit because I think one of the core concepts that you mentioned, I'm going to go a little deeper with, if possible, is the phase 1 and phase 2 biofilm. So, why does this matter? First of all, knowing that there's 2 phases, and what's the difference? Okay,
so as the biofilm is forming, it can be disrupted more easily with the hydrochloric acid, the enzymes, with the aromatic foods, the oregano oil, things like oregano oil is like a phase 1 biofilm disruptor. So, eating oregano, eating thyme, rosemary, incorporating these spices into your food, and then you can get into more, if you're low in enzymes or hydrochloric acid, to replace that. Things like that can break up the biofilm in the phase 1 early stages of the biofilm. Now, as the biofilm starts developing this exterior matrix, it's a stronger biofilm and along a spectrum. So in the beginning stages, you've got the phase 1 that should get broken up and disrupted and move along. The bacteria is released and it moves along. But then as it gets stronger, then you've got like moving towards phase 2. Phase 2, again, it's a continuum. So, you can use some things like olive leaf extract or black cumin in the middle phases or early phase 2. But as we get into stronger, like they've been around longer and they're stronger and the bacteria are multiplying in there, that's when you get these strong biofilms that you have to use more therapeutic doses. That's where you get the chronic illness. People have been sick for a while or keep recurrent illnesses, like they get a little better and then they get sick again, or then another illness pops up. Those are those stronger phase 2 biofilms. And they're much harder to penetrate and break up. Like you have to break up that exterior matrix to release them. So, because when they're in that exterior phase 2 matrix, the antibiotics can't get in there and the immune system can't get in there. So those bacteria are protected, or viruses are protected.
And like you said, this can happen in any kind of cavity of the body, really, like, lungs, sinuses, bladder, GI, obviously, we've talked about that.
SIBO, all the whole digestive tract is a big area of biofilm. I think what I was hearing is correct. I haven't seen the research on that, but it really makes a lot of sense to me that these infections are coming through our digestive tract, and then they're breaking off and being released into other areas of the body.
Amazing. Yeah. And, it's interesting because, like, we're talking about this today, but researchers are working on a lot of aspects of biofilm. I pull up studies on this kind of topic called quorum sensing, where, this signaling that the bacteria does to recruit other bacteria to this community or to push bacteria to go to other parts of the body. Like medications are being developed today to intercept this concept called quorum sensing. Is that right?
Yes, that is absolutely right. So yeah, it's a communication that we're starting to understand. I mean, there's a lot about bacteria that we don't understand. What I'm always amazed at, I've heard studies where there's a Klebsiella strain and one person has this very resistant Klebsiella, and then someone in the hospital somewhere else gets the same Klebsiella strain, and they don't even know how they got it. And how do those?
I think we lost you first.
Interesting phenomenon that we don't really understand yet. And I believe it's a lot about bacteria that we don't understand. And bacteriophages, which, we didn't, but it brings me to these bacteriophages, which are actually viruses that can kill bacteria, but also that have a way of finding the bacteria. There's a lot where we're in the beginning stages of understanding, but for the person who's dealing with a chronic illness, what you want to do is find somebody who understands biofilms. And, nobody should be suffering with chronic illness. And yet we have an epidemic of chronic illness. And partially it's because people end up with diagnoses like IBS or IC or chronic allergies, and they're given symptomatic relief, which sometimes works and many times doesn't work, and they're not really getting well. So, and that's where naturopathic medicine can offer so much to help people get well. And, there's a lot of natural treatments that can help with these biofilms, and the sooner you address them, the better.
Yeah. And I think we were sharing before we got started here how, you kind of sparked a fire under me as far as, thinking about biofilms again. And, I've kind of gone back and forth with it throughout my career. But it really makes a lot of sense now based on your use of lab testing and to kind of analyze what microbes are growing. And the more I learn about, what should be there in a kind of healthy microbiome state, and which bugs kind of come out to play when it's not a healthy microbiome, it's really clued me into like when we need to have biofilm treatments on board.
Yeah, and I have a Facebook group about UTIs and interstitial cystitis, and what I'm seeing is a lot of people using these biofilm disruptors on their own. And I think, we've come to a time of do-it-yourself medicine, because people are desperate. They want somebody, they want someone to help them, but they're not getting the help through their insurance companies and their doctors. So they're searching for the answers on their own, but it's very hard to do this on your own. It's, and even understanding the testing, it's hard to do it on your own. And people ask, how do you test for biofilms? And it's like, firstly, if you're alive, you've got biofilms. And then, how do you know if you have stronger biofilms? Well, that's where I do the microgen testing, and you can do that for sinuses, you can do it for the bladder, you could do it for the vagina, you could do it for the gut. And that, gives us a lot more. They test 50,000 different bacteria. So we get a broad idea. There's another lab called Aperionics that also they test a lot of bacteria. I don't even remember how many, but and viruses too. But again, you need a doctor who can read that. Some people will come in, get the testing on their own, and they don't even know what they're doing with that information. But yeah.
Yeah, and also, I think it's important to know that if you do start treating biofilm, you can feel quite lousy from, it's all of a sudden releasing the biosubstance, that your body has to deal with on itself, that because it's a biological material that you're actually releasing. So,
yeah, I've been seeing some questions about that. People saying, "Oh, I took the biofilm phase 2 disruptor, and now I'm feeling terrible." Well, you can have systemic effects. You can have biofilms in your cardiovascular system, in your gut, in your sinuses, and they can be broken up and releasing those bacteria.
Yep. Before we conclude, it's kind of more of an advanced question, but we're kind of at that point in this conversation. So you hear a lot about the biofilm harboring other things like mycotoxin and metals.
Mm-hmm.
Can you comment on that?
Well, there's definitely information about especially mercury in the biofilms, in the biofilm matrix. And so do we know if the methyl mercury we're being exposed to in our food or in vaccines is causing some of those biofilms? That's, these are somewhat questions that, I don't know if we want to answer because, sometimes I get to the point in my understanding of things that I say, well, okay, what can I do about this? It's like, we can only do so much to change what's happening. These things have been, especially the antibiotic resistance. We have been watching this since since penicillin was developed.
Yeah.
We've been watching this for 70 years, the antibiotic resistance developing, and it's a serious healthcare issue. And so, even though heavy metals can be part of the biofilm at this point, I think we need to start looking at how do we keep people off antibiotics, as a primary concern. Sorry if I'm evading that question, but it's sort of like, I don't know what we can do about it at this point, other than working with chelators like EDTA or,
That makes sense. I think, one of my mentors always said, there's lots of doors to open, but if you open that door, are you going to know what to do when you see what's behind it? So, metals is, obviously something to be cautious with. And, we may find ways and learn ways that this is significant later. But, I think if you're able to sort of the outcomes of, better gut function, better sinus function, better bladder function, better brain function from helping manage this biofilm issues. I think that's kind of where we're at right now.
Yeah, I think we need to especially work on optimize, working with somebody to break up the biofilms. Like the work I do, it's healing, decreasing inflammation, breaking up the biofilms, addressing the infections, whether you do that naturally or with antibacterials. And it's sort of you have to see what's there, in my opinion,
Okay. Well,
to decide what to do.
Yeah, so I think, I'd love to turn things over to you and just kind of hear your take-home messages for, say, a new healthcare provider or a new doctor that's never heard of how to address biofilm, like some take-home messages, and then the patient who's dealing with this kind of chronic infection situation that's not going away, or a chronic health problem. Just a few take-home messages would be great. And then I know since you're doing a lot of telemedicine and lecturing and classes and blogging, can you tell us a little bit about your latest work?
Yeah, so for the patient, if you're dealing with a chronic health issue, I definitely suggest you find a doctor who will do the proper testing and who understands biofilms. Make sure they are a doctor, that they really, there's a lot of practitioners out there who are doing things and making suggestions, but they're not with the facts of what they're doing. And a lot of practitioners are actually just putting people on palliative care, natural palliative care, meaning that they're not, we can use oregano oil, but it'll keep the symptoms down, but it's not going to get rid of the infection for many people. So working on breaking up biofilms and healing and identifying the infections that are there. So that would be my suggestion for a patient. For doctors who are new to biofilms, I love the microgen testing, and you need to learn how to read it. And usually I'll do a biofilm disruptor for 5 days prior to testing, have patients go off all their natural supplements, their probiotics, everything, and then test. And, I do gut testing. I do a lot of GI map testing, and I do sinus testing for people who have chronic sinusitis and also chronic allergies. I still test because I'm seeing a lot of molds, candida, yeasts in there. Also, yeasts are becoming more resistant to standard treatments like diflucan and nystatin. So we need to identify what yeast. There's various other yeasts that I'm seeing in the sinuses and also in the vaginal area and the bladder. So, look into the microgen DX testing, and the periomics and pathnostics as well is another one that I use a lot. And then as far as what I'm doing, I'm working with chronic bladder issues and chronic vaginal issues, but coming at it from a perspective of, breaking up biofilms, decreasing inflammation, healing the bladder and the vaginal tissue, especially if there's hormonal issues, and then looking at the contributing factors like hormonal issues, a lot of PCOS and menopausal issues, and the GI issues as well, a lot of GI issues, which I think a lot of our problems originating from. And I have a Facebook group called ICUTI Recovery. And in that group, I'm doing a Facebook Live every Monday morning at 11 a.m. where I'm answering people's questions. And then I have my Instagram at Dr. Deanna Berman, and my website, which is Dr. Deanna Berman, Deanna, DEANNA BERMAN.com. And also I have another Facebook page that's just Dr. Deanna Berman. And really, I believe we need to become more empowered about our health. One of the things that really is frustrating me these days is how, you need to find a doctor you trust and work with them over time, but you need to trust your doctor. And, people will do things, they'll do a procedure because their doctor told them to. And I see a lot of women getting hysterectomies and cystoscopies and hydrodistensions and all kinds of procedures that they think are not the right thing for them, but their doctor doesn't give them other options. And you have to believe there are other options out there. There's more information. Every day we have more information, and you can get better. So don't give up, but find a doctor who will listen to you and you can trust.
Yeah. I encourage all patients to go into any doctor's, like a meeting with their doctor, Google the acronym BRAINS for patient empowerment. And it gives you 5 questions to ask in every doctor's visit when you're being presented a procedure or treatment. And it those are very anxious moments. So having them written out as you go into the meeting, I think these are all really good suggestions. So thank you very much. I really enjoy speaking with you, because what I feel like when I'm speaking with you is that like you're in the trenches with the patient. Like you're not speaking from a standpoint of this kind of like philosophical way to heal. You're actually like seeing what's going on at this in the body, in the surface, and you're doing something about it. So I really appreciate that.
Thank you. Thanks for having me. It's a pleasure speaking with you too.
Yeah, we'll have to do one of these again sometime again soon.
Yeah.
Thank you so much for tuning into this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.